There have been a lot of questions out in the field about anaplasmosis and how the requirement for a veterinary feed directive could affect our ability to control clinical cases of anaplasmosis. It's a really big deal here in Kansas. Anaplasmosis is a protozoan parasite, very small organism, that parasitizes the red blood cells of cattle. It's kind of a reverse type of disease where we usually think of older, more mature animals as being more immune and having less of a problem with disease than the very young. This one's actually reversed in that a very young animal can generate new red cells fast enough that the body can clear the old ones and the animal looks sick for a while but gets over it. In contrast, say a 4 to 5 year old bull which has never been exposed will clear the infected red cells at a rate much faster than new ones can be generated, and therefore it's often fatal due to that loss of the ability in the blood to carry oxygen. To counter that, in the vector season, which in Kansas is often from around late July to early August until about 30 days after a killing frost, during that season we have fed chlortetracycline in mineral or in feed. The label for chlortetracycline in the feed allows for up to 1/2 milligram per pound per day for control of active infection of anaplasmosis. In mineral, the label is for 6,000 grams per ton, which would be the equivalent of 3 grams per pound of mineral. It is labeled to be given at a rate allowing up to 2 milligrams per pound of body weight of the cow or bull per day. The problem is that to do that, a 1,500 pound cow would have to eat a pound of mineral every day. Which those of you out there feeding mineral to cows knows that's not something that would happen or we want to happen. There have been some things done to allow higher intakes in these cows and bulls that are not labeled. Therefore, they are illegal. They're illegal today before the new labels come out, and they will continue to be illegal afterwards. This is a real challenge for us in that a veterinarian cannot in any way authorize an off-label use of a drug in or on animal feed. We're having discussions currently, and we'll keep people updated as to exactly how this will play out, but in my opinion, this could be one of the biggest adverse effects of really bringing to bear adherence to the actual label of the drug, and that in my conversations with veterinarians, we may not be able to get adequate concentrations into these animals to control active infection of anaplasmosis at the label rates.